As you might imagine, with all this talk, so much pressure, so much tension building over it, more and more people across our area are saying, well, what if I've got coronavirus? How would I know? But we're also finding people are having a very difficult time when it comes to getting tested. But through our reporting, we were able to find testing help for at least one of those folks tonight. Thanks for being with us at 10 o'clock. I'm Patrick Nolan.
And I'm Jane Monreal. In a Fox 4 exclusive report, investigative reporter Rob Manch speaks with a man who thinks he contracted the virus on a cruise and then helps find that man a doctor to test him.
19-year-old Corbin Farmer is sitting in his car in front of the Cape Coral Urgent Care, and I am 10 feet away, struggling to hear what he's saying. But I'm not getting any closer because he might have the coronavirus.
It's like I'm not asking for a cure or something. I just want to know whether I have it or I don't.
Let's go back a bit to where I interviewed Farmer in a safer way, through a computer screen. He tells me this all started, as many coronavirus cases do, on a cruise.
We all had fun. We all were in the Bahamas, party for a week.
Partied on a cruise through this service called STFU and Party. But Farmer says the problems didn't start until he got back. His ship docked in the port of Everglades last Friday, and while he was going through customs, he was stopped by staff.
So I was in that room with all the workers. They did the normal stuff. They pulled all the stuff out of my bag, searched me, patted me down.
Farmer's afraid that contact might have been the source of the virus. Only 4 days later, 3 workers at the Port of Everglades tested positive. Meanwhile, Farmer was getting a serious sore throat.
It was completely closing up that night, 1 a.m., completely closed up, couldn't get a breath of air, was freaking out. It was maybe only 30 seconds I couldn't breathe, but it felt like 5 minutes,
Without knowing what he had, Farmer locked himself in his room.
I got a dad that has Huntington's disease that I can't give it to. I got a grandma that I don't want to give it to, I'm not worried about myself. I'm going to get through this. It's just, do I have something that I'm passing on or do I not?
That's a question that Farmer found hard to answer. He called the COVID-19 hotline. He called Lee Health. He called the Florida Department of Health. Finally, he called me.
Is that really what I have to do to get tested, is go on the news? Is it that bad?
Through my reporting, I had learned the Cape Coral Urgent Care had done some tests.
They've been looking as far north as Port Charlotte, and we've had somebody as far south as Bonita who's come here because they can't find anybody local to take care of them.
That's Dr. Adam Hall. He's tested 5 people so far.
We take their symptoms over the phone. If we think that they have enough criteria, they have fever, cough, shortness of breath, and one of those other risk factors, then we're going to want them to stay in their car, have them wear a mask. We're going to go out and we're going to get nasal swabs and oral swabs and send those for testing.
So that's why Farmer and I are in this parking lot as Dr. Hall comes out in a mask and smock. He agreed to give Farmer a test while I stayed a safe distance away. It did not look fun. I watched as the doctor put the nasal and mouth swabs in a bag, but Hall says they can't do this for everyone.
We have enough kits right now for 50, and then hopefully they'll send some more supplies.
The official number of positive cases statewide right now stands at 34, but Farmer says he doesn't believe it.
That number's not right. There's no way that, it's probably triple that.
That's his guess, but we have no way of knowing right now. In Cape Coral, Rob Manch, Fox 4, in your corner.